Hey guys, Dr. Paul here. Now, after you have a wisdom tooth removed, it's common to experience pain, but there are some other things that you're going to experience as well. In this video, we're going to cover exactly what to expect, things that might help your healing afterwards, and then ways that you can reduce the pain. Now, it is a long video, but it's going to cover absolutely everything that you need to know, so don't go anywhere. Now, after having a tooth removed, everyone responds differently, some better, some worse. What I tell most of my patients as a rule of thumb is that you'll experience most of the symptoms for about a week afterwards. In some cases, the worst case scenario is it's going to last up to 2 weeks, but around that 1 week mark, you'll feel significantly better. So the first one is pain or discomfort, and it's probably the most common thing that you'll feel after an extraction. Now, it varies when it comes and goes, but in most cases for most of my patients, it's probably gone within about a week. For some of the more difficult procedures, it can be up to 2 weeks. Now, a lot of the time, you'll feel most of that pain probably towards the end of the day. Reason being for this is that during the day, you're doing a lot more, you're a bit more active, you just don't know that the pain is there. When you're sitting down, you're relaxing, you do notice it a bit more. So the next one is bleeding. Now, having a tooth taken out is like having an open wound anywhere on your body. There's going to be blood. Now, that blood is actually going to stabilize and form a blood clot within about 24 hours. Through that period of time, and sometimes a day or two after, there can be a little bit of oozing of blood from the site. It then mixes with your saliva and it can make you feel like you've got a mouthful of blood. Don't worry, this is normal. And unless you have some sort of healing difficulty, it's not likely that there is actually a lot of blood there, so don't worry too much. So the next one is dry socket, and this is basically where the blood clot doesn't actually form properly. Now, it actually results in quite a bit of pain. Typically, it happens in about days 2 to 5. Now, the research shows that it happens in approximately 5% of cases, and typically the more difficult the procedure, the more likely it's going to happen. So the next one is swelling. Basically, it's a collection of fluid that happens typically around the site, sometimes up to the ear. Normally, it lasts for about a week. Then we have bruising. And bruising is more common for more difficult extractions, and similar to swelling, it'll last for about a week or so. The next one is trismus, or difficulty in opening. Now, this can be caused by a number of different things, but it is a normal complication to happen. Typically, it's going to resolve within about 2 weeks after the extraction once that inflammation and swelling does die down. Altered sensation to your tongue or lip. Now, because some of these wisdom teeth, they're in very close proximity to the nerve that supplies your tongue and also a different nerve that supplies your lip, it is possible that nerve can be damaged either during the extraction or from compression from the swelling in the area. It's not common that it does happen, but it can. The next one is infection, and this is more common with more difficult procedures, and the symptoms will actually start at about 48 hours. Signs to look out for are swelling or tenderness in the area, fever, or delayed bleeding. Antibiotics are often required, so make sure you tell your dentist if you're worried this might be you. Now, the healing that actually happens afterwards depends on a variety of factors. The first thing is the patient, the second thing is the extraction itself, so we're going to talk about the patient first. First off is the age. The younger you are, the faster that you heal, the less complications that you have associated with the extraction. Gender. Now, the research actually shows us that females typically report more pain after wisdom tooth extractions than the male counterparts. Pain tolerance. Now, I know from my own experience that patients with a lower pain threshold are going to feel more pain after an extraction than someone with a high threshold. General health and systemic diseases. So patients that have lower general health or they have systemic diseases like uncontrolled diabetes or they're immunocompromised, these patients will typically have more complications after an extraction. Smoking. It actually affects how well the body can heal. There's also a lot of research into the links with smoking and dry socket after extractions. Alcohol. Those that drink within 48 hours after extractions are more likely to have complications. Oral contraceptives. Now, the research actually shows us that there is a connection between oral contraceptives and dry socket. So for this reason, where possible, and often this is difficult, if you can have the extraction done during the non-active pill, that would be the best. Now, the next is to do with the extraction itself. First is an upper or lower tooth. The upper one typically heals faster and has less chance of dry socket, and also because of gravity, more food typically collects in the lower one, which can affect the healing a little bit. Now, the second is the difficulty in removing the tooth itself. As a rule of thumb, the more difficult the procedure, the more likely there's going to be complications afterwards. There's also a bit of research to show that the more difficult procedures carry a higher risk of dry socket. Now, in saying that, it's not a hard and fast rule. I've had some patients that had really difficult procedures, no problems after. Some, very simple, lots of problems after. So, what can you do about it? Well, like I said, things typically turn back to normal within about 2 weeks. If they don't, that's something that you might want to tell your dentist about. So now I'm going to run through all of the complications and I'm going to let you know what you can do before and after to minimize your risks. Hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. So pain. The best way to get on top of this is medication. What I always recommend to my patients is to start the medication while you're still numb. So you've just had the procedure, and either right afterwards or when you get home, you're going to take the medication. It's a lot easier to get on top of the pain while it's still numb as opposed to waiting till the numbness to wear off and then trying to take some pain relief. Now, a very effective combination is paracetamol or acetaminophen and ibuprofen. Paracetamol is a painkiller, and ibuprofen is an anti-inflammatory that's going to reduce the inflammation and the swelling. Individually, they work really well, but together, they actually work better than if they're separate. So that's why you take them together. So you typically take that combination 3 to 4 times per day, and the maximum dosage is 4,000 milligrams for paracetamol, 3,200 milligrams for ibuprofen. Now, if you're pregnant, don't have ibuprofen unless it's recommended by your doctor. On a side note, there's no research to show that codeine is more effective than this combination, so typically we avoid drugs with codeine in it just because of its addiction potential. Now, when we think about what might increase pain, it's kind of like if you have a cut on your arm. If that happens, to make sure that it heals really well and is pain-free, you're just not going to use your arm. It's the same thing with your mouth. So that means limiting talking, eating on the other side, just taking it easy as much as possible. The other thing is that physical activity increases your heart rate, which will increase blood flow to the area, and that will also increase pain. So try and avoid that for the first few days at least. Now, there is also some research to show that acupuncture can help before or after surgery, but this is not something that most dentists would actually be able to do for you. Now, the next is bleeding, and a small amount of bleeding is common. And in most cases, a lot of that bleeding probably would have actually stopped by the time you leave the dentist. So like I mentioned, that blood can mix with your saliva and make you feel like you've got a mouthful of blood. This, again, is normal. The bleeding that you want to be concerned about is if your mouth is pooling with blood that you feel is excessive. Now, your dentist or surgeon may have given you some gauze to take home to control that bleeding. How you use it is you wet it under the tap, just so it doesn't stick to the blood clot. Put it in, you bite down onto it for half an hour. If that doesn't work, you do the same thing with a tea bag. Tea basically has tannic acid in it, which can actually help stop bleeding. So you wet it, bite down on it again. Now, if you don't have anything else, you can use a tea towel or a handkerchief, but just get something on the area to put down some pressure. If none of those things work, that's when you want to be telling your dentist. So the next is dry socket. Now, we know that dry socket is basically a failure for that clot to form properly. So if the clot forms properly, you won't get dry socket. That clot takes about 24 hours for it to form. So the most important time is that first 24-hour period. So helping it heal correctly means avoiding the following: rinsing or spitting, as this can dislodge the clot. Smoking and alcohol can also affect the healing, so avoid that for 48 hours. Have soft foods and chew away from the area to help it heal faster. Limit your physical activity for the first 48 hours, and also limit talking. Now, there's also a mouth rinse that contains chlorhexidine that's also been shown to be very effective in reducing dry socket. The way to use it is right before surgery, and then use it for your rinses afterwards. Now, to ensure that the blood clot does not actually dislodge, don't start rinsing for at least 24 hours afterwards once it does stabilize. And the rinsing that you do is right after you eat to make sure that food doesn't get stuck inside the socket. Now, if you don't have chlorhexidine, you can also use warm salt water. It's not as good, but it's an okay substitute. Now, just for anyone wondering, the use of antibiotics is not shown to be effective in reducing dry socket. So because of the risks associated with taking antibiotics, it's not commonly done. The next is swelling and bruising, and they actually fall into the same category. Typically, they self-resolve within about 2 weeks. And the research does show inconsistent results, but some okay results using ice packs on the area. It can reduce a bit of that inflammation, but also it gives a soothing and numbing effect. So use them for 20 minutes on, then 20 minutes off. Ibuprofen is also a really good medication that you can use, which will decrease the inflammation and the subsequent bruising and swelling. Now, there's also a corticosteroid that your dentist might give you before and after the surgery called dexamethasone. The research shows it gives really good results in reducing bruising, swelling, and difficulty opening. So ask your dentist about this. Difficulty opening. Now, this one falls into a similar category as swelling and bruising in that it resolves within generally about 2 weeks. Now, to help along that process, you can use heat packs on the area as well as muscle stretching exercises just to get some length back into that muscle. Now, if this doesn't return to normal within about 2 weeks, this is something to consult your dentist about. The next is the altered sensations. Now, this will happen with lower wisdom teeth that are more difficult. It doesn't happen very often, but in some cases it can. In the cases it does happen, probably 99% of the time it does actually return to normal at some stage. This might be within a week, it might be within a few months, it might be literally years. Now, there are some medications that you can take to help it return to normal, but the earlier these are started, the better the chance that it is going to come back to normal. So if this is you, make sure you tell your dentist early on. The last is infection. And to be honest, you don't actually have a lot of control over this happening or not. and its occurrence is actually very inconsistent. Probably the most important thing is recognizing the signs that we discussed earlier and letting your dentist know as soon as you think those things are happening. Now, not everybody does this, but some dentists have a general rule of thumb that for the more difficult wisdom tooth extractions, or if they're taking 4 out in one go, they will actually prescribe antibiotics to reduce the chance of this happening. Not everyone does it, but your surgeon might. So in summary, there are a lot of things that can happen after you have wisdom tooth surgery. Thankfully, there are some ways that you can help them resolve, like we've discussed today, and they also pretty much will resolve within about 2 weeks. Things should return back to normal. As a rule of thumb, so you're aware if things are going okay or not, is to let pain be your guide. If it's not sore, it's more than likely that things are healing really well. If it is sore, you just need to give it a bit more time. Anyway guys, thanks so much for watching. If you have any questions, put them in the comment section. I always try and get to them as soon as I can. And if you enjoyed the video, got something out of it, please like, share, subscribe. Those things really help me out a lot. Have a good day guys, and keep on smiling.